Okay, thank you. Oh my gosh. All right. So for those of you who do not know, I was born in Brooklyn, born and raised in Brooklyn. Lived there until I was in high school. Hated my parents because they moved me to Texas, El Paso, Texas, actually, and actually thought everybody rode horses. That's how naive I was when I moved from New York. I went to UTEP for a couple of years. I eventually graduated from University of Texas Permian Basin with a degree in management. Before one of my first careers was in banking. I did that for 10 years. And then after my degree, I became a manager of medical and dental practices. So I understand insurance from adminning it from that perspective. Also, I know how to do billing, and that's why I can help my clients negotiate bills. And I've been an insurance agent almost 10 years now, since December of 2012. There's a picture of some of our pets, the whole 4-dog crew, our cat Houdini, and our 2 parrots, Ari and Lily. So if you call me, you'll hear them yelling in the background. Okay, so why JKapp Consulting? So all those things I just explained to you is why I'm different. Most insurance brokers are just trying to sell you a product. I'm trying to solve a problem. So yes, I get paid. One of the biggest questions I get from people is, well, how much do you charge? Well, I don't charge you anything. I get paid by the insurance companies. So, and pretty much the commission is the same no matter which product I help clients with. So my real goal is to finding the right product that matches your need. So I'm going to give a little example here in a minute as far as individuals go on how I help individuals. But business owners, we can completely customize a plan. The key is being able to have a meeting and discussing this with the business owner. So as I kind of mentioned in my marketing moment, renewals are coming out, rates go up every year because it's based on usage, age, demographics, all those kinds of things. And with business owners, I can't help them reduce their costs if we don't have a conversation. I know everyone's busy, but if I can't talk to you and find out how are you using the insurance, do you have employees in multiple states, which cannot become tricky when we're offering benefits. What do you want to do for your employees? Do you want them to have a low deductible or a high deductible? Do we want to give them choices of a low deductible? Of a high deductible, and they could buy up to a lower deductible. There's all kinds of creative things we can do to lower costs. But again, it comes down to having a conversation and a one-on-one with me as your broker in order to do that. So the other piece I give is educating. I can come and visit with your employees, explain their benefits. Most people do not understand their benefits, and that's why they're unhappy, because they're expecting something that is either not covered on their plan or they do not understand how to use their insurance. I try to help people explain how to use their insurance so they're happy. So when I'm looking, no matter whether it's an employer or an individual, I'm looking at your total healthcare cost. When you have a consult with me, as an individual, I am going to ask you, who are your doctors? What medications do you take? Of course, I'm going to get your birth date. I'm going to get your zip code. I'm going to get your expected income. The reason I ask all these questions is because that's how I'm going to match you for the plan you need. Why would I give you a plan when you tell me you go to the doctor every month and you have this expense, and I give you a high deductible plan that pays nothing until you hit a deductible? You're going to be very unhappy with that. So we look at the bottom line. Your premium comes into play, also your copays, prescription, doctor visits, all those things are a factor to what your healthcare costs truly are. So this is something I wanted to show this. So as an individual, if you call me and you need health insurance, one of the places I can search for healthcare is the marketplace. And what I've done here with this gentleman, so the reason I use this example is because when you look at it, I got all the information, and then I got 3 plan choices based on the information he gave me. You could see the first one says $0 monthly premium. The middle one is almost $30, which is Blue Cross, because everyone thinks they want Blue Cross. And then the last one says $83. So first looking at this, you would think I'm going to pick the $0 plan because I don't have to pay for any premium. But this gentleman told me that he has back pain. He's going to see a back specialist, all these things. He had all these medications. So he's going to be seeing a specialist a lot. The specialist copay on the $0 plan is $125. On the plan that pays $83, it's only $5. So adding all those things up together, I've actually saving him money by paying $83 a month for a premium instead of doing the zero deductible plan. And I do that for everybody. We figure out what your bottom line is going to be. So how I educate, I know I'm running out of time. So how I educate people, just because you have insurance doesn't mean you have to use it. I know that sounds counterintuitive, but the whole point is not spending a whole lot of money. You have insurance in case something bad happens. You want that to be covered. Prescription coverage. If you're paying co-pays for prescriptions, look at GoodRx to see what the cost is. Because if you're paying more than $3 for generic on your plan, you may be overpaying for your prescription. And negotiate. You can always negotiate your bill. I don't have enough time to explain how that works, but never be afraid to ask for a discount. So some good referrals, my golden geese. Anyone that's complaining about health insurance costs, let me sit down and do a deep dive and explain to you what's out there. People who have the most sticker shock are people who are used to employer coverage and no longer have employer coverage. They don't know what's available out there. So open enrollment is starting November 1st. Please get on my schedule at JKappConsulting.com and I can do a consult and give you your best options for healthcare.